Welcome to Pretty Lies and Alibis. Let's seek the truth and travel the long road to justice together. What you know, Alibis, welcome to another episode of Pretty Lies and Alibis. I'm Gigi. We are going to jump back into part 3 of our deep dive in the Ellen Greenberg case. But first, music fact of the day. Critics were not kind to Billy Joel back in the 1970s. So what was his response? He would just rip their reviews up while on stage. Tomorrow, I may take a break from this and update on some cases that we've been covering just to keep things current with that. I tell you, this is a rabbit hole, this Ellen Greenberg case, especially for somebody like me who hasn't followed this really until a few days ago. So it's a lot to catch up on. We may backtrack some. I'm really trying to keep this kind of in a certain order that makes sense, but I still have a lot of documents to go through. On January 27th of 2011, we know that the preliminary autopsy results homicide for the manner of death. Then on February 18th of 2011, it officially was considered a suicide. PathologyOutlines.com has a sharp force injuries study, and I read that. Included in the study were the findings that the number and location of stab wounds can give clues regarding the manner of death. Multiple deep stab wounds are generally seen in homicides. Progressively deeper wounds with a single fatal stab wound are typically seen in suicides. And the title of this episode is A Difference of Opinion, because we're going to largely go through today what every other professional in this field concluded, which is very different than what Dr. Osborne concluded. We didn't talk about Ellen's toxicology report. The only thing they found in there was a trace of Ambien and positive for clonazepam, both of which had been prescribed by the doctor she was seeing. Therapeutic levels, nothing above and beyond. On the last episode, we went through the reprimand for Dr. Osborne back in 2012. So I was going through all the documents this weekend. Guess what? There's another one. In an email from December 16th of 2013, Dr. Osborne was emailed by Sam Galino about lack of documentation. It says, I was contacted by the chief of trauma surgery at AEMC to let me know about a serious issue that occurred at their hospital with regard to a homicide victim. While I was gathering information about this, I learned Chris had been notified of this manner several days ago, and he notified you as the case doctor. However, I'm discouraged to see that neither you or Chris documented anything about this in CME. This is completely unacceptable that this important information was not recorded. Furthermore, since the information provided was about a physician continuing to dissect and examine the body after the person was dead, which may amount to evidence tampering, you should have recognized the need to notify me about this so that the issue could be referred to the DA's office. I expect you to take this case as an opportunity to rethink and improve your practices with regard to documentation. So January 28th, 2011, after Dr. Osborne's preliminary manner of death being homicide after on scene, this was very quickly deemed a suicide. Hands were off. Everybody was free to go in and out. I bet there was some panic within that police department because suicide very quickly was determined. They had to prepare affidavits of probable cause to obtain a search warrant to go back into the apartment. The Philadelphia police served a search warrant, and 2 days, this reminded me a lot of Alec Murdaugh in how the crime scene had been cleaned up prior to the search warrant. Also, there's people in and out of that house. You've got the property manager, you've got the cleaning company, you've got the uncle going in there and getting things. You're talking about very precious evidence that was literally wiped away by a cleaning company. The property manager, Melissa, told them that she had taken a video of the crime scene before it was cleaned, so they asked her to provide a copy of that. To this day, as far as anybody knows, that video, the only one, by the way, that shows the crime scene before it was cleaned, guess what? Unaccounted for. Isn't that suspicious? Also, on the 28th, investigators sent a subpoena for Ellen's medical records from her psychiatrist, which were put into the case file. On the 29th of January, investigators told reporters they were leaning towards suicide as the manner of death. And what was the reason? Ellen had been on anti-anxiety medication, and they were looking into mental issues Ellen may have had. Now, listen, remember, Ellen's doctor reported she did not think Ellen was suicidal. And also, if you remember, her mom, Sandy, talked to her that morning as Ellen was driving into work, said it was a normal conversation. It is reckless to say that somebody that is on a medication that a lot of us are on makes her have mental issues that would want to kill herself. The other thing, Ellen was not new to these meds. She had been on them and had had no issues. Also, weighing in their decision to change the manner of death was the fact that the door was locked from the inside and there were no signs of an intruder. I was looking at the photo of the door. And those locks are kind of hard to kick in. I mean, almost you would probably break the door frame, but you only see that the screws are kind of separated from the wall. I just got to thinking, is there some way maybe those screws were loosened before to allow kicking in that door a little bit easier? Just a thought I had. Also, Dr. Wayne Ross notes in his independent findings that the security guard who was said to have accompanied Sam when he broke the door down was not present when Sam left the lobby to go break the door down, and the security guard denies he was there when it happened. Also mentioned in the original medical examiner report, neuropathologist Dr. Lucy Rourke examined the spinal cord and concluded there is no defect of the spinal cord. However, when Dr. Rourke was asked by the Philadelphia Inquirer in 2018, she acknowledged she did contract work for the medical examiner's office, but she said there was no bill, no invoice, or a report from her on the case. And she told the publication, I would conclude that I did not see the specimen in question, although there is a remote possibility it was shown to me. However, I have no recollection of such a case. That was a big part of their conclusion into the manner of death being suicide, because if you remember, it was said in the report that she would have been able to continue stabbing herself after that terrible neck injury. They based that on an exam that is quite possible never happened. Red flag. So, different medical opinions contradicting Dr. Osborne's findings. We're taking a lot of seasoned veterans who are giving opinions. How many of them agreed with Dr. Osborne that this was self-inflicted? Big fat zero. None of them even remotely close, not even in the same zip code as Dr. Osborne. Dr. Cyril Recht. This guy has been doing autopsies for 50 plus years. I've seen him on things before. He reviewed the records and the materials at the request of Ellen's parents. Here is what his conclusions were. Suicidal stab wounds can rarely be multiple, and that method is less frequent. With knives cut to the wrists and throat are most often associated with this type. There may be additional cuts to the wrist or tentative stabbings to see if it will hurt or just working up the courage. Then there will likely be one wound to the chest. Stab wounds to the back are unlikely to be suicide. A murder usually involves multiple stab wounds to the side, back, and stomach. The multiple stab wounds to the back of the upper neck and lower head found at autopsy were unlikely self-inflicted stab wounds, especially the different directions the wounds were inflicted in. The wounds high up the back of the neck and lower back of her head are also unlikely for self-inflicted wounds. Self-harm victims will oftentimes leave a note, but none was left. No indication from family, friends, co-workers, or the psychiatrist she was seeing. There was no indication she was depressed the day she was found dead. She sounded normal with her mom on the phone that morning and also texting with a friend midday. A suicide victim will rarely stab herself through her clothing. Instead, she will open her shirt to expose the skin. Stabbing through clothing may indicate homicide. He concludes it with, it is my professional opinion that the manner of death, Ellen Greenberg, is strongly suspicious of homicide. In 2016, Dr. Wayne Ross agreed that authorities should investigate this case as a homicide and his further opinion to a reasonable degree of medical certainty that the manner of death is homicide. Then in January of 2017, he submitted his findings. So let's go through those. Some of this may be repetitive, but I think it's important, even if we hear the same things kind of over and over in a different way, to show that you have a group of really good pathologists and forensic examiners who are directly disputing the findings from Dr. Osborne. So, what did Dr. Ross say? There was evidence of a stab wound which penetrated the cranial cavity and severed the cranial nerves and brain. As a result, she would experience severe pain, cranial nerve dysfunction, and traumatic brain signs, symptoms including tingling, numbness, irregular heartbeat, and bradycardia, which is slower than normal heart rate, respiratory depression, neurogenic shock, and impaired or loss of consciousness. He also said there is substantial forensic evidence that the scene findings are inconsistent with suicide. In fact, the scene findings to him are compatible with being staged. Bloodstain patterns are inconsistent with suicide. Drip patterns on the front of the body, perfectly placed on body from high up, is an indication of homicide. Minimal cast off is compatible with control, another indication of homicide. What is cast off? This occurs when an assailant swings the blood-stained object back before inflicting another blow. It then flings blood onto nearby surfaces. Analysts can tell the direction of the impacting object by the shape of the spatter. Stab wounds to the front of the body after head and neck stab wounds, inconsistent with suicide. Bloodstain patterns and void patterns, inconsistent with suicide. No cast-off patterns, drip patterns, splash patterns from head wounds either standing or sitting, inconsistent with suicide. Reconstruction of head wound patterns would cause ample blood stains, but these are not present. Instead, there are void patterns. Bloodstain patterns to front of the body, inconsistent with self-infliction. Void patterns inconsistent with suicide and self-infliction. Glasses indicate staging. Remember, there were glasses just to the right of her, as well as that towel in her hand also indicates staging. The towel in the hand would prevent the ability to stab the back of the head, apart from general inability to stab the back of the head. Minimal blood stains to towel indicates staging. Thus, if holding towel during stabbing would mean only the right hand was used for the stabbing. One-handed stabbing to the head and neck is inconsistent with self-infliction, but consistent with homicide. If holding a towel with left hand during stabbing would mean only the right hand was used, one-handed stabbing to the head and neck is inconsistent with self-infliction, consistent with homicide. Bloodstain evidence inconsistent with ability to stab the back of the head and then the chest due to the injury to the brain, cranial nerves, blood vessels in the brain, cerebral spinal fluid leak, spinal cord nerves and blood vessels, and horrifying pain. Lack of cut wound to hands, inconsistent with suicide. Stab wounds in general, inconsistent with suicide since they will cause excruciating, if not incapacitating pain. Pills accessible on counter to overdose on. In other words, there were other options than this very painful route, should that have been her intention, which we all can use a little bit of common sense and say, this was not a suicide. There was no suicide note. She has means of escape out of residence prior to the incident. She is not trapped with nowhere to go. She is trapped on the day of the incident. No suicidal ideation, no previous attempts, no mental disorder, only an anxiety disorder alone. Therapeutic treatment for anxiety disorder. No sex kit performed to address binding and sexual abuse. No controlled substance abuse, no controlled substances at autopsy, no hesitation wounds on the arms, hesitation wounds on head and chest due to staging, incapacitated by strangulation, defensive wounds / binding to the wrists, defensive wounds on legs. Older wounds on extremities indicate abuse, not self-infliction. Wounds to the brain inconsistent with locomotion and motor activity. Wounds to the chest inconsistent with locomotion and motor activity. Crime scene indicates control. The knives in the sink are inconsistent with suicide. It indicates staging. Rigor mortis in hands, possibly feet, but not examined. If present in feet, then it's a homicide. Wounds to head and neck, not documented in investigation report. Head and back of neck, not examined at scene, but head and neck findings found at autopsy indicates homicide. Scene should have been processed for subtle blood stains in the sink, the counter, or other areas indicating cleanup and staging. If performed, it would indicate homicide. The scene was not processed for homicide. The male actor not photographed for injuries or blood stains. Clothing not examined for blood stains. No tumors in brain to cause suicide. No incapacitating diseases to cause suicide. Doctors Galino I hope I'm saying this right, Dr. Galino's conclusion that he did not have a reason to disagree with Dr. Osborne's ultimate conclusion that this was a suicide based on the absence of defensive knife wounds, the clustered hesitation mark, and Dr. Emory's conclusion that the spinal cord was not damaged. However, this is not proof of suicide. Minimal evidence in view of overwhelming evidence of homicide. Therefore, manner of death should be based on forensic methodology, which prioritizes this case as to be pursued as homicide. Dr. Osborne states the body findings indicate homicide. He changed the death certificate from homicide to suicide based on scene investigation evidence supplied post-autopsy by the PPD and DA representatives, which allegedly stated security guard was present when boyfriend allegedly broke into the apartment. The inside security bar lock was broken from the outside. The scene investigation evidence about the security guard is in dispute because the security guard was not present with the boyfriend and door bar lock was disturbed from the inside. Therefore, the case should be pursued as a homicide, or at minimum, I agree with Dr. Osborne that the manner of death must be changed to cannot be determined. I also agree with the following representations by Dr. Emory. We will get to her opinions later. The 1.1 centimeter cut through the dura and spinal column was not caused by autopsy. Testifying about Emory 3A, she says she is confident it is a sharp force injury, a bona fide sharp force injury, and the 1.1 centimeter cut is not an autopsy related finding. The 1.1 centimeter cut was not caused at autopsy, and the absence of hemorrhage could mean Ellen was dead when it was administered. Analyzing Emory 3B, she confirms no hemorrhage at the 1.1 centimeter cut site, which means lack of hemorrhage means no pulse. Analyzing Emory 3E, she testifies that no hemorrhage at the dura cut or spinal column injury. She further testified, and by the fact that now the dura is not demonstrating hemorrhage, as you found also that the spinal column didn't, would that weigh a little bit more in suggesting that Ellen was dead at the time this wound was administered? The answer, yes. She acknowledges hemorrhage presently appears on spinal column, but nowhere the 1.1 centimeter cut is located, and she would not expect hemorrhage associated with a cut of spine to be washed away over time. And washed away at autopsy, they wash the body, they clean it up so they can get a better look. And that was one thing that Dr. Emory said could be a possibility, but it's really unlikely. And Gavin Fish interviewed a friend of his who was a medical examiner. It's a great interview, by the way. That dude needs his own show when he retires. He was so easy to listen to. It does happen. It's just not super common. She states Ellen could not self-inflict, obviously, if she were dead. Dr. Emory and I agree that within reasonable degree of medical certainty, Ellen sustained the 1.1 centimeter cut after she was already dead and the cut was not self-inflicted. Review of the slide supports within a reasonable degree of medical certainty that the manner of Ellen's death was not suicide. Slides A, B, C, D, E, and F were examined with conventional stains, glycophorin stains, and CD45 stains. The spinal cord showed soft tissue hemorrhage and white blood cells, but no reaction to the spinal cord itself. In determining manner of death, pathologists in Pennsylvania follow definitions ascribed to suicide, homicide, and could not be determined, as stated in a guide for manner of death classification by the National Association of Medical Examiners, as an adopted in the Medical Examiner and Coroner's Handbook on Death Registration and Fetal Death Reporting by the National Center for Health Statistics. According to NAME's guide to classify death as suicide, the burden need not go beyond any reasonable doubt, but should exceed more likely than not. That is, the burden of proof should be more compelling than 51%, which barely exceeds chance. The NAME's guide maintains the selection of suicide as a manner of death requires a 70% or greater degree of medical certainty. The necessary degree of medical certainty to support the selection of suicide as the manner of Ellen's death is patently lacking. All my opinions in this report and my prior reports are expressed within a reasonable degree of medical certainty. Should further information become available, I reserve the right to amend this report at any time. Let's jump to Dr. Lindsay Emory's conclusions. She examined the specimen for around 45 minutes to an hour. She also took sections to look microscopically at a cellular level. There was a defect in the vertebral column and ligaments. The spinal column are bones. The spinal cord is actually nerves, tissues, and cells. So there's a defect in the column, which is the bone. Sharp force injury to the dura. We talked about that. Graphics up on the screen here. That is a covering of the brain and spinal cord. Disruption of the tissue covering the spinal cord. No hemorrhage, and possible reasons for no hemorrhage didn't go past the dura. The injury did not disrupt or injure the tissue enough, or the injuries happened after Ellen was dead. A report from Detective Scott Eelman, who specializes in crime scene reconstruction, evidence processing, and management. Let's go over some blood stains because that's what we're going to talk about here. Passive stains occur when indirect forces such as gravity acting on the injured body. These can be drops, flows, and pools of blood. Transfer stains, obviously objects or surroundings coming into contact with the blood. They can be drag marks, they can be cloth patterns, shoe or footprints, handprints, fingerprints, wipes, and swipes. Projected or impact stains, these occur by the blood that traveled in the air. Impact stains occur by when a force is applied to the source of blood. And then we have projected stains. They occur by the respiratory system, arterial blood vessels, or the weapons that cause the injury. These can be spatters, sprays, mists, and spurts. He walks through the entire crime scene and points out where the blood was found on her and at the scene. These were his findings. Ellen was found in the corner of the kitchen area of the apartment between the sink and the stove. Her back was leaning against the corner cabinet. She was slumped downward with her feet and arms extended. A white colored towel was located in her left hand and was also extended downward towards her feet. Her head was slightly tilted forward and to the right, with her chin resting against her right shoulder and the right lateral portion of her head resting against the face of the corner cabinet. The bloodstains on her face are inconsistent with the position in which she was found. He notes the bloodstains found on her sweatshirt would indicate the blood came from above. That level, most likely the head or neck, and her head was tilted forward at the time. On her sweatshirt and pants, the blood pattern is consistent with dropped blood. The circular appearing bloodstains on the shirt and the upper pants indicate the source of blood was directly over or nearly directly over the pants and shirt where the bloodstains were deposited. The greater number of circular bloodstains noted on the left upper leg as compared to the right upper leg of the sweatpants would indicate the source of blood would have been concentrated for a longer period of time over the left upper leg. The lack of blood stains to the lower legs of the pants, coupled with the small circular blood stain to the tops of the boots, would indicate the lower legs were obstructed from the dropped blood. This would be consistent with Ellen being in a seated position, her head leaning forward with her feet flat on the floor. The void patterns to the upper portion of the sweatpants between the waist and the upper legs are also consistent with this theory. Should Ellen have been standing at the time of the blood being dropped onto her upper pants, these blood stains would be elliptical in nature and have some evidence of directionality. One would also expect to find blood stain on the lower pants leg as well. No photographs were provided of the back of Ellen's clothes, but the blood flow patterns and injuries to the neck would indicate blood stains on the back of her clothing. While some transfer patterns were observed to the stove side of the cabinet face of the corner cabinet, there were no significant transfer patterns noted in this area. Swipe patterns on the sink cabinet face and corner indicate Ellen's bloody hair came in contact with this cabinet face. The first contact was near the opening side of the cabinet face and moved rearward. It's a hard word to say. Her head was then separated from the cabinet face and later recontacted the cabinet face in a lower position than the original contact, where it moved backward and slightly downward. No other obvious swipe patterns were noted to the cabinet face. None of these bloodstains accounts for the flow patterns noted to the front of Ellen's face. The number and volume of drops noted to her sweatshirt, sweatpants, and boots is significant. The number of bloodstains on the floor, however, is minimal in comparison to those found on her clothing. The bloodstain noted to the floor between her right hand and the eyeglasses is of particular interest. The bloodstain has a hard edge, indicating there was either an intervening object preventing the flow of blood any further, or that the blood stain was somehow altered. There is an area of pinkish discoloration noted to the lower edge of the blood stain, which may indicate some form of attempt to clean up or other alteration of the blood stain. There's also a significant pattern noted within the blood stain itself, which may be consistent with the footwear pattern or something else. The photos do not clearly depict the bottom of Ellen's boots. There are some blood stains evident to the bottom right of the boot. One would expect to see other pattern transfer stains on the floor in the locations where she stepped. Talk about a crappy investigation. I mean, good grief, y'all. It's mind-blowing that this is still ruled what it is. All these years later, with all of these top-notch professionals pretty much saying that medical examiner report was hogwash. It says, in my opinion, Ellen was not in the position in which she was found at the time the blood was deposited on her sweatpants, sweatshirt, and shoes. It is also my opinion that her head has been in several positions during the time of blood flow, and it remained so for enough time as to have the blood flow across her face and back towards her ear, upward towards her eyes, and also downward towards her chin. It is my opinion the bloodstain evidence in this case is inconsistent with the position in which Ellen was found. I have serious concerns regarding the patterned bloodstains to the left of Ellen's right leg, the minimal amount of bloodstains on the floor in comparison with those found on the clothing, and the flow patterns of the bloodstains on her face relative to the position in which she was found. Moving on to a report by Elaine Pagliaro and Henry C. Lee from the Henry C. Lee Institute of Forensic Science at the University of New Haven. This report was done January 29th, 2018, so more of a recent one compared to when this murder happened. What were their summary of the findings? Assuming all of the blood noted was the deceased, the bloodstain patterns indicate she was in a standing position when she received her initial injuries, which caused the blood to drip on the kitchen sink, counter, cabinet, and drops on the floor. Subsequently, she was on the floor with her head leaning forward, producing all the blood drops that fell onto her pants and between her legs. 2 separate contact stains were found on the cabinet near her. One stain was consistent with a wiper from right to left. The second was consistent with a hair swipe, indicating her hair with blood from her head injury came in contact with the cabinet in a downward direction. The stab wounds are consistent with being caused by a knife, but there is no indication of the length or width of the knife, except for the wound in which the knife was embedded to the handle. The deceased received additional wounds to her neck and head that were not clear in seen photographs, and they couldn't make additional observations on those patterns at the time they did this report. The number of wounds and bloodstain patterns observed are consistent with a homicide scene. Moving on to a death analysis by Tom Brenner. He was hired by Ellen's parents, Dr. Josh and Miss Sandy. Some of the information in the beginning of this report we just went through. I'll highlight what we haven't discussed yet. It's unknown whether crime scene photos or forensics were performed by police. According to witnesses, the property manager and the security man, police looked around the apartment and without any medical information determined the death to be a suicide and abandoned the crime scene. The property manager and security man had to remain with the victim for hours until medical examiner personnel could remove the victim. My question is, why did it take until around 2 to 3 a.m. for her body to be taken out of that apartment? That 911 call was made at 6:31 p.m. And if they declared this a suicide really quickly, what's the holdup? And it's just a really long time to have a body on scene when you're saying it's a suicide. The autopsy was performed without police presence. After discovering 10 stab wounds to the neck, the 6.5 centimeter wound to the scalp, and multiple bruises in various stages of healing, Medical examiner personnel say they notified the lead detective of the autopsy findings and informed them the manner of death was homicide. Due to the fact they abandoned the crime scene, they were forced to prepare affidavits of probable cause to obtain a search warrant to re-enter the apartment. Prior to police returning to the apartment, the prominent attorney uncle of the fiancée entered the apartment on January 27th and removed the victim's work laptop, personal laptop, cell phone, engagement ring, and credit cards. Police did not retrieve those items until January 29th. The fiancé's family and attorney uncle had an opportunity but did not return these items to the victim's family on January 28th when they attended the victim's funeral in Harrisburg, Pennsylvania. Fraudulent statements regarding the findings of an examination of the wound to Ellen's spinal cord were placed in the medical examiner's autopsy report at a later date in order to justify the findings of suicide. The neurological forensic pathologist who was quoted in the report does not recall the case, does not recall being asked to examine the spinal cord specimen, and stated if she did examine the specimen, she would have submitted her findings on an invoice with charges for her work. To date, this alleged report has not been found. Invoices with documented findings of the doctor's work does not exist prior to January 27th or after January 27th. The victim's family consultant contacted medical director Dr. Sam Galino and requested to interview Dr. Osborne. Dr. Galino stated he would not permit any such interview. After several attempts, Dr. Galino stated he would permit Dr. Osborne to be interviewed via a conference call since Dr. Wayne Ross was involved and Dr. Ross was a medical professional. During the interview, Dr. Osborne was asked why he changed the manner of death from homicide to suicide. Brace yourself, people. Dr. Osborne responded he made the change at the request of police because police said there was a lack of defense wounds. Any one of those critical injuries that she sustained could have rendered her totally unable to defend herself due to pain, labored breathing, heart not pumping correctly. We don't know the order these came in. But again, he made the change at the request of police because the police said there was a lack of defensive wounds. Chew on that for a minute. Following a change of administration in the DA's office several years later, the consultant again contacted Dr. Galino to request a meeting. He informed the consultant to contact the district attorney, Mr. Larry Krasner, and have Mr. Krasner notify all interested parties of such a meeting, and Mr. Krasner had the authority to demand the police be present. Dr. Galino said he would be happy to host the meeting and his secretary would make the arrangements. The consultant asked Dr. Galino why the manner of death was changed. Brace yourself again. Dr. Galino stated, "You don't understand. The police said there was no one else with her in the apartment. I had to do something." In February of 2018, Mr. Krasner recused himself from this case and sent the file on to the Pennsylvania Attorney General's office. The consultant learned the specimen of the victim's spinal cord was preserved in the medical examiner's lab. Permission to examine the specimen was obtained. Dr. Wayne Ross, a neurological forensic pathologist, court qualified as an expert in the examination of stab wounds, and several other forensic experts examined the specimen. The findings were the severity of the wound to the spinal cord was such that it would have totally incapacitated the victim and caused death, thus preventing the victim from administering any further stab wounds to herself. Dr. Ross's findings were death as a result of homicide. During the course of the review, an assistant district attorney who was in the DA's office prior to Dr. Krasner assuming the position was contacted by the consultant and asked to review the case file. The ADA stated he found the file in a closet away from the location of all homicide files. The case file was covered with Christmas decorations and did not have a homicide number assigned to it. The ADA said the file was in total disarray and it took several days just to organize it. He went on to say it's one of the first things he noticed was the report regarding the spinal cord examination was not in the file. He contacted the medical examiner's office to obtain a copy of the report, and the medical examiner's office told him the report did not exist. The ADA agreed with the consultant following his review that a basic death investigation was never performed by the police. The ADA is anxious to view the condition of the file and review its contents once it is obtained from the Attorney General's office. Under some Christmas decorations, really? The AG's office had the case file for approximately 14 months. Witnesses interviewed by the AG's office remarked the investigators were totally unprofessional and it was evident they did not know what they were doing. The surviving family members and other experts who presented their findings were never interviewed, and the spinal cord specimen was never examined by any of the Attorney General's experts. The AG's office did not publish any of their findings until their office was contacted by the Philadelphia Inquirer Daily News journalist on March 16th, 2019. So we're going to stop here, but you see how they've been denied any chance to have this even reclassified to undetermined is beyond me, and it screams cover up. There is this push, and it's a good push, and I think we need it. We've got to have change. We've got to have this put back to where it can be investigated. But just last month, the parents were shot down again. We're going in chronological order, but not even a month ago, they were told that the manner of death was suicide and case closed. That's it for today. On the next episode, we will pick back up with these differences of opinion, but just shocking to read through all of this and how obvious it is to everybody, but the powers that be that ruled it what it was. All right, guys, hope you have a good rest of the day. We'll see you soon.